A concerning reality that's plagued the Central Valley for decades. Not enough doctors to go around. Medwatch Today's Dennis Valera has more on what Community Medical Centers is doing to train more doctors and keep them here.
Going into healthcare was an easy choice for Sydney Espiritu, especially after the problems her family has had.
It would take months before my grandma could even get an appointment for her primary care physician. God forbid you had to be referred to a specialist. That would take absolutely forever to get an appointment.
Now in her third year in medical school, the Delano native knows things haven't really gotten better.
I had a patient who had been waiting for an appointment for a whole year. She was off of her medications for a whole year because she couldn't get an appointment with us, and now her condition is worsening.
According to University of California data, in Fresno and surrounding Central Valley communities, there are 43 to 64 primary care physicians on average per 100,000 people. Compare that to the state number of 72. Dr. Kenny Bond, assistant dean at UCSF Fresno, says the shortage worsens when you look at who doesn't accept Medi-Cal, which is used by more than 40% of the population here, and specialty doctors.
A lot of people don't realize that there's a shortage in all specialties. You know, we have a shortage in surgeons and dermatologists, and mental health is decimated, a huge shortage in mental health providers.
Dr. Bond helps run UCSF's San Joaquin Valley program in medical education, also known as SJV Prime. The program looks to fill the Valley's doctor gap by recruiting Valley natives like Espiritu so they'll take root and practice here.
If you look at outcomes for where physicians practice, the two biggest predictors are basically where they finished training and where they're from.
It started 6 years ago and is based at UC Davis, but thanks to newly attained accreditation earlier this year, it will be full-time at UCSF Fresno starting fall 2019. The transfer means training in Fresno went from 6 months to a year to at least 2.5 years.
It's not just about learning to be a doctor, but it's about learning to be a doctor that can address our healthcare needs and our issues here in the Valley.
While UCSF has been the long-standing institution trying to help fix the shortage, California Health Sciences University is already helping make a dent. CHSU, started in 2012, graduated its first class this past May from its College of Pharmacy. Of the 62 grads, 80% are already working in the Valley. Catherine Beza is one of them, currently interning at Rite Aid. A Fresno native, she says she wouldn't be in that coat if it weren't for CHSU being in the area.
I was a young mom, and when the pharmacy school was not here, you know, our options were kind of limited. And when the pharmacy school opened up, it just happened to be a year after I got my bachelor's.
Most think pharmacists are just filling prescriptions.
It's not about you any longer.
But as CHSU's provost Wendy Duncan says, the scope of pharmacy has expanded over the years.
In California in particular, there's a new designation for pharmacists, the advanced practice pharmacist, that has a larger scope of practice, and they can actually even prescribe a limited set of medications and enter into collaborative practice agreements with physicians.
We're standing in what will be the courtyard.
But CHSU's reach is set to expand. Under construction is their proposed College of Osteopathic Medicine. Pending accreditation, it's projected to be done by December 2019 and open for students by spring of 2020. It would make CHSU the first four-year medical school in the Valley, something the UC system has been eyeing for many, many years. Governor Brown signed a bill in September establishing a fund that, once it's filled with $500 million, will go toward a UCSF School of Medicine branch here in the Valley. It's not clear exactly how the money will be raised, though. What's your kind of end goal? Where do you see yourself?
I see myself working back in Delano.
That new school would be able to enroll 50 students a class, meaning more chances for students like Espiritu to stay and learn here at home.
To be immersed in the community that you grew up in is an incredibly special experience that a lot of medical students may not be able to have, and it's just been such a blessing to be close to home.
UCSF and CHSU, they have programs recruiting students as soon as high school. More information about those programs will be online with this story at medwatchtoday.com.